Hi, good afternoon, everyone, and thank you for attending this session of Green Rounds. I'd like to welcome our presenter for today, Missy Travis, who will be presenting on the topic of healthcare environment reservoirs. At this time, I'm going to stop sharing my screen and turn the presentation over to Missy.
Okay, thank you so much. Good morning, everyone. Just a moment, I'm going to pull up my screen. Okay, can someone confirm you can see my slides okay?
Looks great.
Perfect. Okay. Well, thank you all for joining today. We are going to do a session from CDC's Project Firstline. If you are unfamiliar with Project Firstline, it is a collaboration that was created by CDC to use with other healthcare facilities and public health entities to be able to educate frontline healthcare workers. These materials that I'm going to be going through today are available for you to use on the web. So if you see something that looks interesting that you would like to share with your own facility or your staff, then you can access any of these materials on the Project Firstline website, and I'll be sharing that at the end of the presentation. You will also notice the simple terms that are used in these presentations, and that was done intentionally so that they could be used across a variety of groups in healthcare that would include clinical and non-clinical people. I also want to point you to the link that was posted in the chat. I will be referencing this participant booklet throughout the presentation. So if you want to go ahead and click on that link and download the booklet, you can go ahead and do that right now. I also want to let you know that this is going to be more of an interactive presentation. So hopefully you guys are up for doing some discussion today and also for participating with me in some of the questions. Since we talked about cleaning and disinfection when I presented several weeks ago, I thought that the topic of healthcare environment reservoirs would be a good follow-up presentation just to talk about, since we've already discussed how to clean, how to disinfect. Now we can kind of take a step even before the cleaning and disinfection by looking at the reservoirs that cause us some concern in healthcare. So we're going to talk about where germs live in the healthcare environment. We'll also talk about how our understanding of these environmental reservoirs can be applied to infection control in healthcare, and how you can use your knowledge to anticipate when there could be risk for germs to spread, so you can take action to keep it from ever happening. We'll have an opportunity to reflect before we wrap up at the end. So it should be no surprise to anybody on this call that germs are part of everyday life. The world is covered in germs, especially in healthcare. When we think about where germs live in the healthcare environment and the steps we can take to keep germs from spreading, we think of 4 core reservoirs: water and wet surfaces, dry surfaces, devices, and dust and dirt. While these aren't the only places where you can find germs in the healthcare environment, we want to focus on them for our discussion about infection control because they are a common source of spread. The definitions of these reservoirs are mostly self-explanatory. So today we'll discuss why they're so important and how we can use our knowledge about them to recognize the risks for germs to spread. You might have more experience with some reservoirs than others based on your job, your daily tasks, and your interactions. It's important to remember that everyone, no matter your training or role, can recognize an infection risk if you understand where germs live and the way they spread. Before we start, I'd like to ask you a question. Based on your own work, are some reservoirs more top of mind than others when you think about the risks for germs to spread? And why might that be? Please use the chat now, or if you want to come off mute and just participate that way. Let me know what you think about these two questions. What are there some reservoirs that come top of mind, and why might that be? And I'll just give you just a moment to respond. This is that participation piece that I was talking about. Okay, so we have a little bit of a shy group today, so I'll get us started. I can say for me, I feel like dry surfaces is one that comes top of mind just because I feel like that's one that we talk about frequently. And I see Ashley just put dry surfaces, doorknobs. I also tend to think a lot about medical devices just because, I'm an infection preventionist. And so we focus a lot on infections that are associated with devices. So just continue to think about those. And each of these environmental reservoirs has an impact on our daily work lives. And we're going to explore some of the more obvious risks of each of these reservoirs, as well as some that might not be so obvious. Oh, thank you, Betty, for putting that. Clothing, uniforms. Yes, that's another good one that we think about frequently, is just, whenever we're going into patients' rooms and working in healthcare, how we can pick up these germs on our clothing and our uniforms. So that's a great point. Let's start our discussion with water and wet surfaces. Water is used a lot in healthcare and in many different ways. Although tap water is safe to drink for most people, it isn't sterile. Because most water and wet surfaces are good places for germs to grow, it's important to be careful with water in healthcare. Germs can spread by water in a few ways: by touch, like when you get germs from water on your hands, or when medical instruments get wet and can then grow germs that can spread to patients. Germs can also spread by splashes and sprays, not just into your eyes, nose, and mouth, but also onto skin or equipment. Breathing in is another way germs can be spread by water. When water gets into the air as very small droplets, it can be breathed in and carry germs to the lungs. Some examples of germs that we see in water are Acinetobacter, Serratia, Pseudomonas, and Legionella is probably one that we hear about quite a bit, especially in infection prevention. Now that we've described why water and wet surfaces can pose risks for germs to spread, let's discuss actions we can take to address those risks. Regardless of our professional roles in healthcare, we can also recognize risks with this reservoir. Please take a moment to jot down in your booklet how you interact with water and wet surfaces during your workday. Now let's share some quick ideas. Please type into the chat one interaction that you wrote down with water and wet surfaces. And I'll start us off again. One that I think about frequently is ice machines, especially when I'm doing environmental rounds, making sure that our ice machines are clean, that they're being maintained in a way that they should be. Okay, great. I see some examples: hand washing, cleaning equipment, water on the countertop. Yes, that's a great one, Chelsea. I had also written down splash zone. As you all know, there's that zone right around the sink where we don't want to store clean items that we call the splash zone, because they can become wet from the water when you're washing your hands or rinsing items. Washing patients, bathing, that's a great example. Eye wash stations, yeah, that's a very interesting example, Christy. I hadn't even thought about eye wash stations. Another thing is, we've all heard not to store under sinks. That's one of the reasons why we don't want to store clean items under the sink, because we know that pipes can burst and sinks can leak, and that can also cause things to become wet. So thank you for those great examples. Now let's focus on actions we can take to keep germs from spreading from water and wet surface. Thinking about the potential risks associated with the interactions you thought of, does anyone have ideas about infection control actions we can take to prevent germs from spreading from water and wet surfaces? Oh, great. So Deborah, you were a little ahead of me there because you said sprinklers and protecting linen. So yes, one of the things that we can do is cover those clean items like linens to protect them from water. Splash guards, yes, great example. That was great. Thank you guys for those examples. Now let's move on to dry surfaces. They include high-touch surfaces like bed rails and door handles, as well as surfaces like countertops and bed curtains. Many germs found on the body, in the air, and in stool can end up on dry surfaces, and they can spread very easily. Hands can pick germs up and move them to other surfaces and people. Germs from dry surfaces can also get on devices and can be spread when those devices are used on or in patients. So some examples of the germs that we see on dry surfaces would include multi-drug resistant organisms. Many times you can see things such as MRSA because that lives on the skin and lots of people are touching those surfaces with their hands. I think about Clostridium difficile or C. diff, which is another organism that can survive for a long period of time, very similar to some of our other multi-drug resistant organisms. We also think about viruses. Hepatitis B is a virus that can survive for long periods of time on dry surfaces. Rotavirus, norovirus, we think about those big outbreaks associated with norovirus because of its ability to survive outside the body. And also most recently, we've heard much about Candida auris, which is another organism, a fungus that can survive for long periods of time outside the body on those dry surfaces. So similar to how we talked about before, think about how do you interact with dry surfaces at work? And put a couple of examples in your participant booklet. And now, just like before, let's share some of those thoughts. Please type in the chat some of the ways that you encounter dry surfaces during your workday. Great examples, personal devices, keyboard, yes, we touch those all the time. Wows, yes, your workstations on wheels, your doorknobs, elevator buttons, all of those little high-touch surfaces, your mouse, if you have a mouse for your computer. So now thinking about these examples and the possible risks for germs to spread from dry surfaces, what are some infection control actions that will keep that from happening? And the first thing that comes to mind for me is just cleaning and disinfection, right? Yes, there I see Chelsea put that in. Routine sanitization with alcohol, hand washing, yes, hand hygiene. Approved hospital wipes, yes, using those hospital approved disinfectants. Another one I thought about was isolation precautions, wearing our PPE. Okay, thank you guys so much for those examples. Now we'll move to dirt and dust. Outdoor construction projects near a healthcare facility or indoor projects like building maintenance or renovation can send dirt and dust into the air. The germs in that dirt and dust can harm certain patients if they're breathed in. The germs can also spread by touch, especially by hands when dirt and dust land on surfaces and devices. If the germs are spread to central lines or wounds, they can get into a patient's body and cause infection. So some examples of the germs that we tend to think about in dirt and dust are Aspergillus and Cryptococcus. So similar to what we discussed with our other two categories, think about some instances at work when you encounter dirt and dust, and jot down a couple of examples in your booklet. And after you jot those down, please share some in the chat. Parking garage, yes, that's a really interesting example, Jessica. Thank you for that. Construction, yes, construction projects, lots of construction projects. Yes, especially if you work in a large medical center. I worked in a university medical center, and it seemed like we were doing projects, a new project every day. AC units, yes. What about, do you all ever run into whenever they're redoing the wiring in the ceiling and they start taking out ceiling tiles? That's another one that seems to come up frequently, where all of a sudden you come into work and all the ceiling tiles are missing because they're redoing some wiring above the ceiling. So those are some great examples. Have you ever thought about the potential risks for germs to spread from dirt and dust? And if so, what are some of the actions that we can do in terms of infection prevention that can keep that dust from spreading? And share some of those in the chat if you don't mind. Barrier wall, yes, that's a perfect example. Wet mop, yes. HEPA filtration, great. Negative pressure, great, yes. Looking at the ventilation, making sure you have barriers. And many times in infection prevention, we're doing regular rounds, especially if we know we have construction projects going on, to make sure that all of those things are in place, that we have good filtration of the air, that the ventilation is good, that our barriers have not been torn down. Excellent. Thank you all. So finally, we are going to move on to devices. Devices and equipment can have germs on them as well. Some devices are used on a patient's body, like a stethoscope or a blood pressure cuff. Other kinds of devices are used in a patient's body, like an IV needle, an endoscope, or an artificial hip. Germs can spread through devices by bypassing or breaking down the body's defenses. In fact, devices can be the entryway into the body for germs. When they are used on or in a patient's body to provide care, any germs on them can be spread to the patient. Touch is another important way that germs can be spread by devices, especially devices and equipment that are shared and used by multiple healthcare workers. They can spread germs between patients and also pick up germs from a patient and carry them to other surfaces and people. So some examples here would be germs from the patient's body. So it can be from the skin, from the gut, and even from the blood. So like what we did before with our three other sections that we were talking about, thinking about devices and equipment, how do you use these at work? And note a few examples in your booklet and also in the chat. Medication administration, perfect, yes. If you do surgery at your facility or invasive devices, using invasive devices, if you do dialysis, if you insert Foley catheters. So in healthcare, we use a lot of devices on and in patients, as we mentioned earlier. So there's a ton of examples in healthcare. So similar to before, thinking about your interactions with devices and the potential risk for germs, what are some actions that we can do to keep those same germs from spreading from that device to the patient. Using sterile technique, yes. It's a great example. A couple of the ones that I wrote down were using the manufacturer's instructions for cleaning and reprocessing medical equipment. I've oftentimes found well-meaning staff reprocessing items that were not meant to be reprocessed or cleaned in between patients, meaning they were disposable, or there was a certain way that they were supposed to be reprocessed. And another thing to think about is just removing the device as soon as possible, because that's really the best way to prevent a device-associated infection, is just to remove the device as quickly as possible. So having a process in place where you're assessing all of your devices to make sure that they're being removed as quickly as they can. That was a great discussion. Thank you all so much for your participation today. I feel like we can learn so much from each other and just the different scenarios that we face each day in healthcare. By using this approach, thinking about the places where germs live in healthcare and the risks for germs to be spread from them, we can understand the infection control actions to take to protect our patients, our colleagues, and ourselves. We started this session by thinking of examples of times when we recognize risks for germs to spread from the environment at work. After our discussion, what are one or two new strategies you can use to apply this thinking? So just using your participant booklet again, think about how you can start using some of the things that we talked about today. And maybe there were some things that we discussed that you hadn't thought about before. Okay, here we go. There's a poll on my screen. I don't know if you all can see that, but it's kind of causing me from being able to move forward. But we're almost to the end of the presentation, so that's okay. We covered a lot today. Does anyone have any questions remaining or items I can clarify about the healthcare environment and reservoirs, or just any other comments? If you've had some unusual encounters before with the environment, and anything having to do with infection prevention in the environment. I can tell you another example of something. I actually worked at a facility where we built a brand new hospital. And I wasn't involved as much as I would have liked to have been from the beginning, because one of the things I saw in the plans whenever we started looking at the different rooms is they had planned for a big water feature in the main entrance to the hospital. It was right in the middle of the huge entrance, and there was a waiting room there, and it was also the entry to the emergency department. And as an infection preventionist, that's something that I don't typically prefer to see, especially if we're building a new facility. I would not prefer to have a huge water feature. But one thing that we did immediately, because several people wanted the water features, we just made sure that the group that was taking care of our facility had a handle on how they were going to manage the water, how we were going to routinely check the water and make sure that we were not experiencing any issues. So that's kind of one story that I think of oftentimes when I'm talking about healthcare environment and reservoirs. Thank you guys so much for your time today. These are some of our key takeaways from what we discussed in this session. And just as a reminder, you can access all of these materials from Project Firstline. Even though we covered a lot today, there's still much more to learn, and you can keep exploring these topics on your own using the resources on this slide. Project Firstline has a suite of products to help you learn how to recognize infection control risks at work and help you learn more about where germs live in healthcare and how they spread. You can also follow Project Firstline on social media. So that concludes my presentation. And if anyone has any questions, feel free to unmute or put those in the chat.
All right. I just want to say thank you to Missy for this wonderful presentation. I know Tatiana and I had a really great time discussing your questions and putting stuff in the chat, and I hope everybody else did as well. So I'm going to invite everybody back for our next grand rounds, which is scheduled for next Wednesday at the same time, and I hope to see everybody there. Thank you.